Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. In our PrEP Talk series on overcoming barriers to PrEP engagement in principal populations, our episode today focuses on PrEP uptake in cisgender women. Joining me are Drs. Oni Blackstock and Brittany Williams. Dr. Oni Blackstock is the founder and executive director at Health Justice in New York, New York. And Dr. Brittany Williams is an assistant professor of higher education and student affairs administration at the University of Vermont in Burlington. For the full online educational program, including video roundtables, downloadable slides, and other podcasts in the series, please visit the link in the show notes for this episode. Now let's hear what they have to say about this topic.
I want to talk a little bit about barriers, right? For me as a cisgender Black woman, I remember before I was in a serodiscordant relationship, I just didn't think that HIV was something I would have to face, right? I've always been very open about getting frequently tested and talking to my sexual partners and asking people about their, HIV status and STI status. And are you, seeing a doctor? How often do you go, right? Which asking heterosexual men that question is, it's something, right? But I didn't think about for a very long time that I myself had any, large scale HIV risk, even though I was living in Atlanta, I was dating in Atlanta, right? The state of Georgia has the highest HIV rate for a state in the country. And so, I want to talk a little bit about that.
Yeah, no, I really appreciate you sharing that, because I think in general, both for patients and providers, so for Black women and those healthcare providers who care for Black women, there is often a sense of, most women are at low risk for HIV unless they have some of the, if they're engaged in maybe transactional sex, or if they have a known partner who's living with HIV who may not be taking medication or may not be suppressed. They have known risk factors, but we know that for many women, it's really about, especially Black women, community level risk. So those women may be doing everything that they can do in terms of protecting their own health, but there's so many other factors that elevate their risk. And so I think, just similar to you, like, there are many, many women who don't necessarily see themselves at risk, and that sort of affects whether we seek out PrEP or other forms of HIV prevention. And so I'm wondering for you, like, what made you sort of decide to seek out PrEP, not necessarily initially realizing the potential benefit of it?
So I became aware of PrEP as early as I think it was 2015. I had a friend who was working with HHS, and he was talking a lot about, new emerging strategies for HIV prevention, so on and so forth. And at the time, I was engaged to be married, and I thought that would last a lifetime. And so obviously that didn't happen. And that's not a sad story. I think it's a story of survival and thriving and choosing yourself, right? And I just wasn't thinking about it. And then part of what led me to actually go over from, I have a little bit of knowledge about this because my friend is working in the field, to actually being a user was actively dating someone who was HIV positive. And I knew that I wanted to take our relationship to the next step. I was deeply in love with this person. I thought we were going to spend our lives together. We're still friends, but we're not compatible, because I am team no kids ever, #child free for life. And my partner wanted children. And so we had to have that difficult conversation about what the future of our relationship looks like. But at the time I was thinking, okay, I'm doing the research. I know the science. I get that, U equals U, and that's great. But what can I do for me that doesn't involve putting my trust in my partner, putting my trust in my partner's doctor, but that is really about centering on and focusing on just me, myself, and I. And I feel like as a Black woman, we spend so much time caring for everybody else. We're showing up for so many people. We're putting off our own doctor's appointments and putting ourselves last to take care of our family so often. This was something I could do that's at the forefront, that every day reminds me I'm taking care of myself. And that felt like, it was a really good option, especially once, me and that partner who was HIV positive, once we broke up, the next person I ended up with was also HIV positive, which I think is a coinkydink. I don't really know. It just happened that way. I don't know if it's that I'm giving off this, I'm open to, dating people who are living with HIV. I am, an open-minded person, whatever the case may be, but there are particular kinds of people who've been drawn to me. And I'm like, okay, clearly I need to also maintain my PrEP adherence irrespective of who I'm partnered with. And, I always laugh when I remember when I first went to get my prescription and the doctor asked me, if I was a sex worker. And I'm like, no, but girl, all sex is transactional. What are we even talking about here? Right. It's just something I'm always thinking about.
I think like just what you said, like that experience, like when you were seeking out PrEP, the assumption that was that you had some very like clear like HIV sort of stigmatizing risk factor. And the reality is that you were your reason for wanting PrEP was about self-care. It was about taking control of your sexual health. I'm sure, not having to worry about HIV when you're having sexual relations increases the pleasure of the experience. So I think your experience definitely speaks to, I think, many that women could potentially identify with. And so I think for providers, we have to remember what the CDC guidance is. Really it's like for people who are sexually active. If you're a sexually active woman, your doctor should be talking to you about PrEP. And even if you're not sexually active, asking like, what are your sexual health goals? Because maybe right now you're not sexually active, and maybe in the future you might be, and you might want to use this as a tool. I'm also wondering, a lot of women, you were someone who you said in 2015, you learned about PrEP. So it's like 3 years after it was approved. There are many women who could benefit from PrEP who are still not aware of it. So I'm just wondering if you could talk about your experience and even just talking to other women about PrEP, because one thing I've heard what women say out their mouths is that, why didn't anyone tell me about this? Why didn't anyone tell me that this was for women?
Yeah, it's funny. I hear that all the time too. I didn't know, or, whatever the case may be. Although anyone who follows me on social media cannot say that, because not only is it on my social bios, it's in my Tinder profile, it's on my Hinge. And, for me, part of it is now that I know, I feel I have this social and moral responsibility to share with every other Black woman I'm in community with, or even Black women I don't know. I remember I was in a social media room. The app Clubhouse was kind of popping for a little bit. And I was in a room and I just shut the whole room down. And I said to them, I feel more comfortable having unprotected sex with someone who's living with HIV, who is in care and who is undetectable than I do people who don't go to the doctor and who don't know their status. And I remember everyone being like, oh my God, what are you talking about? Right. And so I used this as sort of a bait to pull people in, because I knew it would be an emotionally charged statement. But then I got an entire room of, I think it was 1,000 people in there at the time, about what PrEP is, what U equal U is, and feeling like it's on me to share some of those things because I actually know. Awareness is the hardest part, in part because I don't feel like I see everyday Black women in the advertisement, right? Even for me, I'm a Black woman. I got a PhD. I got a shifting social class, but I also grew up in the hood and I still have, my connections to my family at home. I'm the only person in my family with this level of education. So I'm always talking to what I say as round the way Black girls, around the way Black women about what PrEP is. And I don't feel like the campaigns speak to those people. It's always these very airbrushed, model-esque, super pretty folk, people who look like they have a lot of wealth. I'm even thinking about some of the commercials where these people have these giant backyards, and I look at the ads all the time and I'm thinking about social class. Girl, can't nobody afford that, right? Who are you actually talking to in the marketing? And so I think part of what can help with awareness is shifting how we do the advertisements, who are the sort of voices and faces of these campaigns, and how do we have meaningful conversations between patient and provider, even if I'm not at the doctor for something relating to HIV or STIs.
Yeah, no, totally. And you've been like such a vocal and visible advocate around PrEP for women. And I agree. I think for women, often stories resonate. And if you are not around, if you're not hearing about other Black women like yourself who are taking PrEP, you're going to think that this might not be something for you. So, and I love how you also brought U equals U, undetectable equals untransmittable into all of that. In terms of finding a provider who was open to taking PrEP, you said that first provider said to you, asked if you were a sex worker. Was that someone that you went back to? And how could that interaction have gone differently? If you did not go back, how could that interaction have gone differently to make you want to continue seeing that provider?
Yeah, that's a really good question. So I did not go back to that provider. She was a nurse practitioner in the women's clinic at the time. And I had to go and see a practitioner. The way our university healthcare system medical center was set up, there was the women's clinic, there was primary care doctors, and then there was something else like specialty doctors. And so I was going to the women's clinic for almost everything because, they were sort of taking care of everything. I didn't really have a general primary care physician because our university used that for folks who had long-standing medical conditions that were chronic and that they need HCP for on the regular. And so I remember having to leave the women's clinic. I'm walking across. I went to go see this other provider, and she became the only person that I spoke to about PrEP. And then because I made such a ruckus about it, they actually referred me to the clinic director. So the only person who saw me when I went to the women's center became the director of the women's center because I was like the problematic patient who was running around and loud and making noise and effectively trash talking. But for me, it wasn't about trash talking. It was about advocacy. And it brought me back to how we sort of minimize and dismiss Black women's complaints and critiques and knowledge of themselves and our bodies and our wellness in medicine so often. I felt like I was having to wage that battle. But for me, it was worth it to be branded as angry or problematic or whatever the case may be, if it's easier for another cisgender woman to get access to a prescription in there. Since that moment, and that was in 2018, since then, I've had difficulty every time I move states. So I've lived in a couple of different states. I'm in academia. Unfortunately, we make absolutely no money. So I'm often going to the place where I'm being recruited to be paid the highest because these are my best earning years, and I recognize that. And every time I move, it is a serious struggle to find a primary care physician, to find a doctor that's willing to oversee the prescription. I found in both instances where I moved states, I've moved to Minnesota, now I'm living in Vermont. In both of those states, I found a gynecologist first, and neither of those doctors' offices were willing to oversee my PrEP prescription because they felt like they couldn't see me that often if I wasn't pregnant. And so even that brings me back to, if people don't have a primary care physician or a clinic or some sort of, city or state sponsored program that's nearby, that's a real barrier to your ability to be able to maintain your prescription, to keep up with taking PrEP. And it might even be a reason that someone says, you know what, well, maybe this isn't something that I need.
Yeah, no, totally. And I think as someone who has been very vocal and can advocate for themselves, and, you are empowered in many ways, maybe compared to other women, I'm wondering, what other women who don't have the resources that you have, what might be ways that they can engage with their providers around this conversation around, whether PrEP is a good fit for them and getting more information about it.
Yeah, absolutely. So I have 3 questions that I tell all women that you should think about talking to your doctors about. So the first is, I heard about this thing called PrEP. Do you know about it? And then being able to see what their doctor actually knows. The second is, if it's someone who's already made a decision that they're interested in and want to get on PrEP, I want to take PrEP and I don't really have a reason. I've just decided this is something I want to add to my healthcare. And then I say to them, if they get pushback, then you say to your doctor, please add a notation in my chart that I asked for a PrEP prescription and you felt like I didn't need it. I have found that providers are much more likely, unfortunately, to give people what they ask. They have to put their medical license or their own sort of professional standing on the line if something were to happen to this person. And then the third thing that I encourage people to constantly ask is, are there people or places that you refer folks to who are interested in exploring their options for HIV/AIDS prevention if it's not something that this office provides? And so I like those 3 questions because they're very basic. You can word them in whatever way that you want. And I try to tell every Black woman for every healthcare and medical issue to use point 2, right? Make them add that note in the chart that you asked for this, that you specific and intentional, because a lot of times, unfortunately, money talks and perception is everything. And documenting and having a registered record of what's going on is always going to be the thing that I think can not only help, but also transform and enhance Black women's lives.
Yes, I love those 3 questions. You should get those trademarked. I love it. But yes, but I think so important to understand, what do our providers know? Have you heard about PrEP, like you said? And then I think the issue around providers need to acknowledge that they have said this, if they are, because providers are gatekeepers. So that's why we need so many healthcare providers to be on board with this, because different from like condoms or other ways of preventing against HIV, like this, you need a prescription. So we really need healthcare providers. And then if they are not comfortable, making sure that they know who to refer the patient to. So I think these are really wonderful, great questions. And then I think that all women at least know one of them or use one of them when they're going to seek care for PrEP. From the provider side, I think we want to make sure that all of our women patients are aware of PrEP, even if they may not feel it's an option for them or a good fit for them, at least they're aware of it, so that if there does come a time that they may need it, that they can access it. And then we also know that women are often sort of leaders of communities and can really spread the word about really effective prevention, health-related strategies. And then obviously talking to all patients, again, anyone who's sexually active, really just beginning to engage women in that conversation about what their sexual health goals are, and sort of wrapping this into overall sexual health, I think is really critical. Britt, I'm wondering for you, what are some lasting points that you want to make sure people take home and understand from the patient perspective?
Yeah, I'm a new yogi. I am a convert to hot yoga. And one of my favorite things about yoga is when they say yoga is for everybody. And I've been taking that to say PrEP is for everybody. So whether you're a teacher, a mom, a firefighter, you're just someone who's trying to make ends meet, it doesn't matter. PrEP is also available for you, I think is the first piece. And the second piece is that you can get PrEP for free or at an extremely low cost, depending on the geographic area that you're in, the communities you're in, whether you have health insurance or not. There are resources available for you to be able to find PrEP if you are interested in it. And I want to make sure, no matter what, that women know that and that they exercise their right to be able to gain access to this, because healthy sex is great sex and everybody deserves great sex.
That's a wonderful point. And thank you so much, Britt, for being in conversation with me.
Thank you very much to Doctors Oni Blackstock and Brittany Williams, and thank you to our listeners for joining in. As a reminder to view the full Path Forward in PrEP, Overcoming Barriers to PrEP Engagement in Principal Populations program on the Clinical Care Options website, click on the link in the show notes. And please be sure to check back for more episodes on important infectious disease topics. Thank you and have a great day.